Welcome to the Healing on Purpose podcast. I'm your host, Dr. Miriam Rahav. The content of this show is meant for informational purposes only and is not intended to diagnose, treat, or cure any illness or health condition. Please discuss all information shared herein with your own personal health authority. Links to the podcast and its YouTube channel will also be available on my practice website, rahavwellness.com. Please join me on my Facebook group, Healing on Purpose Podcast with Dr. Miriam Rahav, to continue this conversation. Enjoy the show. Welcome to Healing on Purpose. I'm your host, Dr. Miriam Rahav, and today I'm really excited to introduce a very special featured guest. Her name is Dr. Kira Oberle. She's a doctor nurse practitioner and a dearly beloved and cherished colleague of mine. We work together at Rahav Wellness, the Center for Collaborative Healing, which is a full-service, full-spectrum functional medicine clinic in the heart of New York City. And I'm so honored to share her with our listenership. And it is my great pleasure to introduce you to her. I know that in these podcast recordings so far, I have shared a little bit about just the meaning of healing on purpose. And me and Dr. Oberle had a meditation on this subject. And I floated an idea her way that what is healing to us is connecting to God's will for our lives and connecting to our purpose. And as an extension of that thought, that if there is a dis-ease, a physical discomfort in the body, it can be a hindrance from our ability to find, follow, and fulfill God's will for our lives. And so this healing journey is also one that we embark on with each and every member of our community to support them on their own quest for purpose, for connection, for God's will for their lives. And in that context, I'm introducing such a bright light as a healer and as a beautiful, nurturing healthcare provider who is sharing this work that is so purposeful. And the question that I am posing to you, Dr. Oberle, is tell us a little bit about your own trajectory, your own journey, and your own healing on purpose journey, if you will.
Sure. Well, thank you so much for having me, and thank you for that wonderful introduction. Yeah, I mean, I feel like we've talked about this so many times, so it's nice to kind of finally be able to sit down and do it in a more concise way, I guess. But I said to you, like, I feel like I've kind of accidentally stumbled into this world a little bit. I always knew that I really liked wanting to do something with either the human body or healthcare related. I didn't really know what that meant. When I was younger, I kind of knew, okay, maybe, a physical therapist or, what could that look like? And it was during college I came across, we did a course, and part of it was to do a practicum and shadow a few different professions. And one of them was a PA, which I really, really liked and thought that was kind of going to be my route. And it was a professor in college that said, okay, well, if you want to be a PA, you should look into being an NP, a nurse practitioner. They're pretty similar roles, and you'll just have more, some more autonomy, more independence. And at 2021, I didn't really even know what that meant, but it was kind of like, okay, sure, like I'll do that. And so kind of going through this nursing route, I didn't really know what I was getting into. And so for those of you who don't know, to be a nurse practitioner, you first have to be a registered nurse. So you're going through the nursing side of things, then you become an NP, and you're taking.
Can you tell for our listeners what nurse training is like? I mean, I think there are these titles, but I don't know if we really know what that means. I can tell you about doctor training, but I'd actually love to hear more.
Yeah. So for a registered nurse, there's so many different roles you could be in. You could be the school nurse. You can be in a pediatrician's office. You could be at the bedside. So in a hospital, you can be the one. They're oftentimes carrying out a lot of the orders that are put in. by a provider. And so whether that's giving medications, and they're doing a lot of the technical things. You could be putting in like a Foley catheter, putting in an IV, different things like that. I will say, just through going through the nursing route and lots of my friends and whatnot, the nurses, because they're at the bedside, they're the first ones at that point of care. So they get very, very good at what they're doing, and they can kind of anticipate different providers' orders and whatnot and kind of say, hey, this is what's happening with the patient, or this is the change in vitals, like what about this or what about that? And so it feels very much more collaborative from my experience going through the nursing route. Even during school, there was a dental school, medical school, nursing school. So there would be like a certain days where we'd kind of do these like integrative days of all kind of working together or having different lenses on the patient. So it feels more like boots on the ground a little bit. Is kind of how I see nursing.
I think a lot of it. And I think that is, as far as I can tell, from my vantage point, it's the nursing superpower. It's that direct contact with the person or the people you're working with. And I think that is what shifted for me as I shifted into a community-based practice, that was the spirit that I always thought that's what I wanted. And I think like you, it's kind of, you don't necessarily fully know, you're kind of intuiting your way and kind of trying things out. And that medicine and you have a lot of the theory too. And maybe you'll tell us more about that route from RN to NP to doctor of NP, because there was so much theory and there was so much academics and there's so many decision points, I think, in doctoring based on that theory. A lot of our training was sitting with other doctors and in that theoretical space.
Mm-hmm.
And we really rely on our nurses as boots on the ground to give us that feedback. And I think our collaborative in the community is like we're all directly super involved with the people we're with. It's so much less compartmentalized and we're all kind of directly there. But I know that sometimes there's boots on the ground skills that I'm like, help me guys.
Right. And so it's nice to have, like, I don't think I necessarily would have appreciated that lens if I were choosing, medical school, PA school, NP school, just kind of been like, yeah, kind of, same old, same old. But it's like, no, they are different. And in hindsight, I very much appreciate seeing that nursing role and just how that, like, I'm even thinking like in school, sometimes we learn, patients are non-compliant with medications or things like that. And the nursing route would say, well, okay, did they have access to a car to get to the pharmacy? Or did they have someone able to pick up their medications, like ask more questions? And rather than just saying, patient is non-compliant. And so there's this kind of whole other side where like you are looking at this whole patient and not only the whole person, but their family constellation and all these other logistics. And so that's kind of ingrained into us through school. And so now being a little older and looking back, it's like, no, like I'm really glad that my training included a lot of that and not just so medicine focused of, okay, did the patient take their meds, yes or no? And so that's, this is where I kind of say, like, I stumbled into it just because I couldn't have probably known that would have been helpful to know. But now in hindsight, it's like, yeah, no, you should know that about your patient. So
Yeah, so that's really interesting because I think what I'm hearing is that nursing as a profession is holistic from the get-go. I sometimes shy around the word patient because the collaborative nature of our practices, we're working with a whole person who's on their healing journey, connecting to with greater likelihood through their healing journey that they're in their purpose. Or sometimes people are like, I have to get well because I have this purpose that I need to fulfill. Anyway, it's an organic thing. It's not something that I'm trying to kind of superimpose on the healing journey. It's just part of that authentic healing journey of like our why, right? And that you're more greatly when you have those whole person centered conversations to know about people's why and to worry about people's how. And I didn't think about that, but it makes so much sense that in our collaborative, in our clinic, that the providers that I would connect to in clinic that we've built this incredible working relationship around come from, like, no wonder I'm working with people from nursing backgrounded practitioners. I'm like, holy, like, wow, of course.
Right. And everyone brings something different to the table. And I would say our practice specifically is very collaborative with the people that we work with. And it's people who want to be there and are purposeful with wanting to be engaged in their healing journey and less, not quite so passive, but an active participant and
My gosh, yes. We
collaborate.
have we have such an amazing community of people we get to work with. So motivated, right? So educated, so committed and so proactive. I say this all the time. We definitely work for the best people ever.
Yes.
It's really such a joy and an honor all the time. And people say, you say that to everyone. I'm like, because I mean it for everyone. I mean, not everyone comes to us. They're really special humans who come and do this work. So tell me, Dr. Oberle, more about the route from, so you said NP, which is autonomous, and you are truly autonomously practicing your practice at Rahav Wellness. And then the route to DNP. Can you tell us? And then from there, sorry, one more thing to add to that is to us and how you found us.
Mm-hmm. Yes, our favorite story. Oh, yeah. So then once RN, then you can go into the nurse practitioner role, which is more of that provider role. So you're the one that's putting in orders, whether that's for lab work, whether that's diagnosing someone, putting in orders for imaging, you can do all that. And the NP license will differ a little bit state to state of how you kind of need to collaborate, but you can do those pretty much independently. In New York State, you can do that. So that's kind of how that role. And then for the NP specifically, you can also get a terminal degree. You can get a doctorate, which is a few more semesters of coursework and clinical things, and specifically just like some case writings with patients. And the doctorate that I did was more clinical based. So taking patients that we've worked with and kind of corroborating it with different, we say, clinical outcomes and whatnot. So lots more writing and
A
research.
lot more theory, right? So I guess in that sense, you kind of come a little bit closer to, I think, what my training was like. I mean, there's that boots on the ground, but there's a lot of that, right? Is that right, do you think?
Yeah. And we would be basically taking patients that we've worked with when we were doing our student rotations and certain like criteria that we have met from working with patients, whether that was needing to escalate them to the emergency department or needing to, send a referral or whatnot, and then kind of pulling different research and kind of rationale for why we did said thing. And so, yeah, kind of a cross between theory as well as the actual clinical, like, hey, what did you do in real life and why did you do that? What was the reasoning for that?
Yeah. Well, that's really interesting because there's this huge, obviously, responsibility and accountability. And so to be accountable to the thought process and ground it, as is I think, the homing signal for clinical practice and evidence, right? And how do we do that? That might be a really interesting thing to share, I think, with our listenership. So we are a functional and integrative medicine practice, and talk a little bit about what that means and how we take those principles from our training and apply it within a functional medicine practice might be really interesting. What are our choice points and what are our rationale? And this is a lot of the bulk of our conversation, right? Because we meet every week and we have clinical meetings where we're really going deep into what's happening and what are the choices we're making. And so let's talk a little bit about that, about applying evidence-based medicine when we're in a different field and how we use that within that different field. Is that that's just coming up,
Yeah.
learning about the DNP and how we apply that here in a same underpinnings, I think, but a different way that we apply it.
Yeah. And I think that's just kind of like science as a whole of what's the rationale for why you're doing something. And okay, now you have said intervention, and what was the outcome? Like, was it an outcome that we like? Great, keep doing it. And if it's an outcome that we either don't like or, maybe we don't want, then it's like, okay, like let's pivot. It's kind of, the scientific method and testing our hypotheses, which we learned in elementary and middle school, but it's sort of this higher level of that. And so we see that in whether that's medical school, nursing school, NP school, even then now at a functional medicine clinic, we're still very evidence-based of we're getting tons and tons of blood work or lab work, and we're getting this evidence or this baseline data to say, okay, like what are your blood sugar markers? What are your inflammatory markers? What are your hormones looking like? And then we'll do an intervention, whether that's supplements, lifestyle changes. There's a whole, world of things that we'll do. And then we'll say, okay, like let's retest. Let's get some new data points and see what these new numbers are. Did our blood sugar numbers improve? Did our inflammatory markers go down? And, we've had tons and tons of case studies and of different things that we've done where it's like, yeah, improvements, not only on our blood markers on numbers on a piece of paper, but also symptomatically. And I think that's the most important too of, well, how do you feel? Do you feel like you have more energy? Do you feel less fatigue? Do you feel less pain? Like who are you as a person? And we talk about this a lot of like, there's these other layers of our body. We so often think about our physical body. That's, our physical vessel. But then beyond that, okay, when we have this healthy physical body, now we have the more wherewithal for our mental body, our emotional body, our spiritual body, and these other layers. And I think that's the point that really matters. And that's why people ultimately are here, whether they're consciously like aware of that or not. But it's like, well, why do you want to not have pain in your body, or why do you want to sleep better? It's like, well, because then if we're sleeping better, we have more energy. If we have more energy, now I can do these hobbies that I want to do. If I can do these hobbies, I can spend them with, my friends and spend time together. And if we're doing that, then I'm happier. It's like, that's what it comes down to.
It does.
Oh.
That's really, really profound. Every week I attend worship services in a community, and there's one adorable gentleman, and he is having a hard time with blood sugar control. And he knows that I am a physician. And he said he just like after prayer services, he was asking me for any tips and suggestions. And he has an adult child who has some developmental disabilities. And he's like, I need to be here for him. So I think that's part of the why, that so many of us are here to stay in relationship, to stay in protectorship. People say, I want to be here for my children. I want to raise my grandchildren. I want to be this kind of a grandma.
Mm-hmm.
I want to be a grandma who teaches my grandkids. This was a conversation I had with an adorable woman about a month ago, and she was teaching her grandkids how to do a headstand. And she was saying, I want to be the kind of grandma who can teach my grandkids how to do a headstand. I want to stay that kind of grandma as long as possible. And I think that was such a beautiful missive to me, to think about all the ways that I can support her to do that are aligned with her. And that we, yes, exactly as you said, we gather that body of evidence, which is, how does someone feel? How is someone sleeping? How are they digesting their food? Like all the physical things, but also if stressors come up, how fast am I to react? How irritable am I? How anxious am I? Am I able to let things go, or do my thoughts loop around in circles? And when we learn, and also the data we collect, right? It's so, so helpful to see every time we collect labs practically that we see people's adrenal function. And the adrenal gland is people's response to stress, right? It's being orchestrated through the adrenal gland. And there's this master hormone that we look at quite a bit called pregnenolone. How many optimal pregnenolones have we seen?
I've maybe seen 3.
It's really remarkable. And how helpful would it be to know that your body is telling you what's really going on because sometimes we just want to tough it out. We want to be victors. We want to move on. We're strong, and we are. And the body keeps the score.
Mm-hmm. Yeah. And I think too, a lot of that comes from, especially like a place like New York, it is very go, go, go kind of hustle culture. And so a lot of this becomes just the norm. And I think we've seen this a lot where you can ask someone, hey, are you stressed? And, not quite those words, but just like, what's going on in your life? And it's kind of like, yeah, no, everything's good. And they'll kind of list off everything they do. It's, they're a parent and working and, trying to juggle all these 12 different balls. And so their nervous system, their body just becomes so used to that as their baseline, where there's not even this sense of like, well, what is it really like to be in this like calm, you say parasympathetic, or this sort of rest digest side of the nervous system. And so those times where we can actually kind of pull someone into parasympathetic, whether that's with neural therapy or something like that, it's like people could finally have that sense of like, oh my gosh, like this is what it feels like to kind of have a quieted mind, or this is what it feels like to, finally like have my shoulders not up to my ears. But when we're so used to that baseline, it's like, yeah, no, this is normal. This is fine. I'm fine. It's like, well, yes, yes, and. And so just to kind of have those like larger conversations too, I think are important. And how can we even get someone to experience or have that touch point of this is really what your nervous system kind of wants or kind of should be. We're all going to go into that kind of stress mode at some points. That's human nature. That's adaptive. But we're so used to just being, I think there a lot. I think you use the words like we get phase locked into that sympathetic.
That is a term I use a lot. I wanted to ask you, dear Dr. Oberle, because we've had so many conversations, but this might be the first time someone hears your voice. And you said neural therapy, and there's a separate conversation that's out there that I recorded on the interwebs, but we should definitely record our own here. But do you want to tell our listeners about it just a little bit, since this is a completely new term for many?
Sure. I like to describe it as a kind of a cross between like trigger points and acupuncture. So instead of acupuncture, which is just, a needle that you'll place in different acupoints, we're actually injecting a little bit of fluid, that fluid being procaine. So it's a cousin of Novocaine or lidocaine. So it's in the family of an anesthetic medicine or medication, but we're not using it for the numbing or the anesthesia. What we're using it is, I like to think of it like a reboot on your cells. And so when those cells are very stressed, those cells are very reactive. And so if we think on a broader scale, when we as humans are more reactive, we'll say things at the end of the day. It's like, I'm at the end of my rope. Any little stimulus, any little noise makes us feel very like, ah. And so our cells can be like that too. And so if we think about the cells, it's like that threshold for what they're able to tolerate is just so much lower. And so what the neural therapy does is it acts like a reboot, or like a reboot on your computer or a reboot on your cells. And it just brings you back to that baseline where you should be. So it's not like the baseline is now, through the roof and there's no stimulus or, nothing's going to make a difference. It's like, no, you're just going to be back to where you're supposed to be. But that reboot or that reset just kind of puts people, or else like kind of pulls them out of that sympathetic and
That
pulls them
sympathetic phase lock, right?
So,
Yeah, one of the things that's interesting on physical exam that I'll sometimes tap like right under the kneecap. There's a point where you tap it where the leg gives a little kick, and we call that patellar reflex. And that's kind of an interesting spot that can tell us a little bit about the nervous system. And for some people, we'll give that little tap with a reflex hammer, and then I'll get this like high kick worthy of the Rockettes. And the way I explain that is like, and I use a lot of examples from my own parenting life, where if I come home and I'm calm and the kids are bickering and there's a mess everywhere, whatever the situation may be, but I'm calm. So I'm like, okay, kids, that's enough. Maybe a timeout. Why don't you go to your rooms and I'll tidy up a little bit, and then we can have dinner together, right? Or there's the day that I was exhausted and I had just maybe a harder day, and I come home and they're situation puts me over the edge, right? And I'm like, be quiet, or like if I am a more snippy snappy, right? There's like less of that, a shorter wick, I guess, like a shorter bandwidth to take on yet another thing, So it's kind of like our nervous system overflows. And so that shows us when we have the same thing with the patellar reflex, that is a nervous system that's irritated and more reactive to something tiny. And that healing really requires space in the nervous system, right? We talk about that parasympathetic, that is the place of calm, and that it is also the stress response is wonderful and necessary and tied to survival. However, it needs to be balanced, right? So we meet our day. Daytime is that sympathetic, it's our checklist, it's our job, it's our commute, it's our tasks, it's our shopping, it's our doing, and associated also with day. And then the parasympathetic is evening, recovery, repair, rest, but also healing. That all like when we are in sleep, that is when I kind of think of like when the shop closes down, when the offices close down, and then come in like, the cleaning services, and that's when the trash gets emptied, and that's when the counters get wiped down and the waste baskets get emptied, right? Like we have this rhythm, and that there's that same rhythm in our body. And so if we never get to do that, we meet the next day and we're still a little unkempt from the night before. If we didn't get to do that tidying, that it can just, right, that there's this buildup. It's very intuitive, but we don't get to speak about it much in the health space, even though I would say, like, from my experience, and I wonder about yours, that it is that parasympathetic insufficiency. It's not a pathology, it's just an imbalance, but it can become embedded over time and become very serious. But if we speak to it and we test it as we do, on every single person, every single time, and we can language it on physical exam. We can show, right, reflexes or a reflection on the nervous system. We can create a reference point. If you give neural therapy and you give that local injection of procaine that gives a little reset, and we do it sometimes over strategic areas. One of the areas that we love, treating people is right over the vagus so that you can kind of open up, or as you say, reset those vagal cells. And the vagus is our highway of that calm and that heal and that repair and that relax. And so it's revelatory, can be, right? To experience like, oh, wait, I can feel this way too. And that will track along with our adrenal markers on labs. It will sometimes track along, and we're getting more clinical here. And so we're going to save some for coming attractions when we're going to do more conversations around maybe a specific set of labs or maybe a trajectory of labs and how things change over time. And I think what our idea was that we would bring here to our listenership conversations similar to what we have in our clinical meetings. So that, of course, without protected health information and, we'll be very HIPAA aware, of course, but that what I really wish is for our greater community, that we can have a greater listening community, even than our clinic community, who can learn how we look at things and how to think about things as part of our own mission to help really expand our community of humans who are empowered on their healing on purpose journey, right? But neural is a big subject. Adrenals are a big subject. How sympathetic, parasympathetic imbalances may show up in labs. These are huge, huge conversations around, and maybe as a subject that you really love, about how that might show up and land in female hormones, right?
Yeah, even markers like heart rate variability is a big one that people.
Ooh, tell us about that a little bit.
We just think about, heart rate, how many times our heart's going to beat every single minute. There's an average, but that's not the same exact number every single minute. So if you go for a run, your heart rate should increase because you need to pump a lot more blood. Versus if you're sleeping, your body just is using less energy, that your heart rate will go down. And so there's this variability or difference in how many beats per minute that heart is beating. And so a very strong nervous system that can alternate between the two, that kind of sympathetic fight or flight, rapid heart rate, and then the parasympathetic, how quickly can it go back and forth? That's a sign of health. And so do we have a good heart rate variability that we can increase our heart rate, we can go for a run, we can do some sort of workout, or we can even just have a stressor, our heart rate can come up and then we can come back down again. And so even if people have like these little biomarker devices and things like that, I don't have them, but I know people will have them. So there's different markers that will be tracked even from the more, I'll say, like standard of care. So we can see these markers in every day, even outside of a, quote, functional medicine lens of things. So it's interesting to kind of see these markers pop up in different areas, or we're all sort of talking about the same thing in different ways.
Yeah, I love what you said. And maybe we'll wrap up a little bit for now with this idea of how heart rate variability is a biofeedback mechanism that each of us can own within our daily living and our daily practice that can give us a lens onto the nervous system. And I think one of the big takeaways from our collaborative practice, you and I, and coming attractions also for our dear colleague Rachel, who's a family nurse practitioner, to join us in conversation about how aware we are of the nervous system and can look at it through lab markers, through heart rate variability, which is absolutely brilliant. Maybe we should evoke more of that, like invite more community members to really share theirs and add that extra layer of insight, and how that ties into gut health and hormonal health and just overall energy and stamina and mood and all the things. But that what we call the nervous system, and specifically we call it the autonomic nervous system, is such a huge player in our overt conversations about what we're holding in our awareness as we work with our wonderful community. And I think we'll leave it at that for now.
I think that's perfect. There's so many topics that we, as you said, we discuss every single week, and it's hard not to start to jump to one and want to talk about it. So, but I think, we can end it there, and then we have so many more things
we'll pick up next time.
About.
I think our coming attractions is maybe we'll take some of these principles and apply it to how, we look at a specific human being and what they're bringing to us to work with and to work on, and show our approach, maybe labs and trajectories, so that hopefully we can just lift up and hug some more people.
I think that's perfect.
On their purposeful journey.
We will.
Dr. Oberle, I am so, so, so grateful to do this work with you every day. And it's really fun to reflect a little bit here in maybe a little more of a formal way. It's different a little bit to sit together and record a conversation. But may this be one of many, many to come where we share our work with the world.
Well, I'm so grateful to be able to work with you and to have this conversation and all of that. I'm very excited for more to come.
Likewise. Thanks for listening to the Healing on Purpose podcast today. I hope you found this information helpful, and I encourage you to share this episode with others who may also benefit from the information shared. Please consider rating and reviewing my podcast on Apple Podcasts so more people can find this information. I also invite you to join the Healing on Purpose podcast Facebook group to continue this conversation. I'll see you there.